Welcome to the Digital Doc series. Today we're going to discuss food sensitivities versus food allergies via a functional medicine lens. And my name is Dr. Blake Butler. I'm a functional medicine provider here at the Aligned Modern Health Wicker Park location. And I'm really excited about today's conversation as I have a strong interest in this topic. And I believe there's a lot of misconceptions regarding food intolerances and food sensitivity testing within the modern media. And if you do a Google search, for instance, you come up with multiple opinions. So the goal of today's conversation is to really provide concrete evidence to support the use of food intolerance testings in an appropriate manner. Before we dive in, though, I like to lay the foundation with regards to functional medicine and clinical nutrition. Just for those who aren't familiar with functional medicine, essentially a functional medicine approach allows us to address the root cause of dysfunction as opposed to putting a band-aid on symptoms. Therefore, our intention is to use diet, lifestyle, genetics, and other factors that address the actual cause of the condition instead of just treating the condition as it presents. So with that, if you look at the infographic here on the left, you'll notice that one condition has many causes. So for instance, we use the example of depression. And with depression, we can see an omega-3 essential fatty acid deficiency, or low thyroid function, or vitamin D deficiency, blood sugar dysregulation, or previous use of antibiotics impacting the gut microbiome all contribute to that presentation of depression. On the other end, we look at inflammation. And quite simply, inflammation is at the foundation of all chronic disease. So I like to give a simple analogy or an explanation via demonstration to help us understand functional medicine and why it's important to regulate inflammation. So imagine taking your hand and scratching the top of your hand for 5 minutes, 5 hours, 5 days, 5 weeks, 5 months, 5 years. You get the idea. It creates a lot of irritation and damage to that tissue. And if we don't systematically remove those triggers that are creating the inflammation, the body never has a chance to heal. And today we're going to focus on one of those triggers, that being food intolerance. But before we talk about food intolerance, or commonly food sensitivity, we have to understand the difference between food allergy versus food sensitivity. With that, a food allergy is typically something that occurs when we respond to a food with an immediate reaction. We actually have what's called an IgE response with a food allergy, and these reactions can be life-threatening. Fortunately, these reactions are less common, but the symptoms include hives, swelling, itching, and a potential anaphylactic response that requires typically an epinephrine pen. Compared to food sensitivities, we see a delayed response when ingesting a food that derives sensitivity or irritation. And that response can take up to 72 hours. Therefore, it's relatively difficult to pinpoint which food is driving the irregular symptoms. The good news regarding food sensitivity is that it's not typically life-threatening from an immediate standpoint. However, if we look at potential risk factors down the line that we'll discuss in more detail today, it can have a significant impact on life and drive pretty significant conditions in certain individuals who are susceptible. Food sensitivities are more common compared to food allergies. So in clinical practice, when I partner with patients, I typically see food sensitivities much more frequently. And when a patient has a food allergy, they typically are aware of that coming into the office, just given previous reactions and previous work via an allergist. With food sensitivities, we look for symptoms such as gas, bloating, skin inflammation, migraines, brain fog, and irregular bowel movements. In fact, just yesterday, I had a patient that I partnered with who experienced chronic migraines, who just indicated that she no longer experienced migraines and hadn't experienced migraines for about 3 to 4 weeks since removing gluten from her diet. So that's going to play into this conversation today, but it's really fun to see these strategies that we'll discuss today actually have an impact on an individual's life. Before we discuss food sensitivity testing and the impact, we have to also understand the gut. Essentially, the digestive tract begins in the mouth, in which we start to break down our food via enzymes that are produced in our saliva. And then it goes all the way through into the stomach, into the small intestine, large intestine, and then out. With digestion, we actually take in approximately 30 to 60 tons of different foods, inclusive of macronutrients, micronutrients, chemicals, and toxins over the course of our lifetime. And our goal with digestion is to actually break down that food appropriately so we can absorb the nutrients and benefit from a systemic standpoint. We know that the digestive tract has a surface area larger than a doubles tennis court, and that large surface area allows us to absorb all of these beneficial nutrients. We also know, according to the best evidence we have, that the immune system is essentially housed in the gut. In fact, about 2/3 of our immune system lives within our gut environment, and therefore our gut immune system has a significant impact on the rest of our body. We talk about the gut-brain connection, and that's something that I'm very interested in because our gut can trigger dysfunction as it relates to our brain. And if we have inflammation or damage to our gut tissue, typically we correlate that with inflammation in the brain. And brain inflammation isn't something you typically feel with regards to pain. We typically see brain fog. So if you've ever experienced brain fog, we have to then look to the gut to understand what may be driving inflammation. And there's a process we look at very specifically as it relates to food sensitivities, and that's referred to as leaky gut. And if you've done some research into functional medicine, you're probably familiar with the term leaky gut, or in the literature, we refer to this as increased intestinal permeability. And this essentially occurs when we ingest food proteins such as wheat, gluten, or dairy. And these food proteins, or even the bacterial byproducts from bad bugs, actually break down the gut barrier system, creating inflammation and causing potential self-attack or an autoimmune presentation. So to look at the image here on the left, you'll see examples of different toxins, bugs, and gluten proteins that are impacting the gut barrier system. So within the gut environment, we consider this the external environment. We try to absorb the good and then get rid of the bad. And in a case of leaky gut, we actually break down that single cell layer, allowing for the bad to come into the bloodstream. And that activates inflammation, immune dysregulation, and it drives oxidative stress, which is essentially a driver of chronic disease. Alessio Fasano, a researcher who really dives into leaky gut, would indicate that leaky gut is the doorway to autoimmunity, inflammation, and cancer. And there's a great paper on that that goes into much more detail than we have time to today. But quite simply, leaky gut can drive inflammation. And as we know, inflammation is the foundation of chronic disease. And food proteins or food triggers can then stimulate leaky gut. In fact, there's studies looking into gluten showing that anyone, even if they don't have a gluten intolerance, can activate the genes associated with leaky gut when consuming gluten. Some, however, are just more resilient, and that's one of the goals too when working from a functional medicine lens. We like to make you as resilient as possible as it relates to your immune function and your response to these toxins and environmental factors that impact our gut health and overall well-being. With regards to what leaky gut can cause, we typically see fatigue, autoimmunity, thyroid dysfunction, pain and inflammation, bloating, and irregular digestion. In addition, we often correlate leaky gut with multiple food sensitivities. So if you're an individual who has increasingly more food sensitivities, or if you've taken an at-home food intolerance test and everything you eat on the test comes back positive, it doesn't mean that you have an intolerance to all these foods per se. It means that all of these food proteins are coming into the bloodstream via this open gate that's allowing more in than what we'd expect, and that's triggering an immune system response in which our immune system creates antibodies to try to fight off that invader. To go into more detail, though, I think it's really important to understand more advanced topics as it relates to food sensitivity and its potential impact on our immune function. So today I'm going to talk about a concept called molecular mimicry. And this is a big term, but essentially this occurs when an amino acid, which is a building block of a protein, actually looks like our own human tissue. And when we ingest certain amino acids or proteins that look like our own human tissue, we can actually create a self-attack on our own tissue. For an example, if we look at cow's milk, we know in research that cow's milk, or the amino acid sequence associated with cow's milk, actually looks a lot like our pancreatic tissue and can trigger or drive type 1 diabetes. And type 1 diabetes, as many of you know, is the autoimmune form of diabetes. Beyond that, we focus heavily on gluten, and I commonly get asked, what's the deal with gluten? Is it good? Is it bad? And when we look at it, it's relatively nuanced. So gluten is not bad for everyone. Gluten's a protein that's found in wheat, barley, rye, so think about breads and pastas and pastries. However, about 1% of the population, up to 3%, depending on what you reference, present with celiac disease, in which gluten causes a breakdown of our intestinal lining. And up to 13% of our population experiences what's called non-celiac gluten sensitivity. So with this, we commonly see individuals who believe they have a reaction to gluten say that they tested negative for celiac, therefore they're able to still consume gluten. In those situations, we say, hey, there's a large number of people who actually react to gluten, but don't show a positive result with regards to celiac testing. And the issue with that is that gluten reactivity drives molecular mimicry. And in the research, we see a correlation with autism, schizophrenia, and Hashimoto's thyroid disease. And in my practice, Hashimoto's comes in nearly every day. In fact, it accounts for approximately 90% of low thyroid cases. And a majority of those individuals, as we partner with them, they experience a significant reduction in symptoms, and we see improvements in thyroid antibodies on a gluten-free diet. Beyond gluten, we commonly look at milk. Specifically with milk, we are actually the only species of mammals that drink milk after infancy. Also, we're the only species that drinks another species' milk. So that doesn't fully add up. And with that, we don't typically have a very good immune reaction. A majority of people who I work with who experience acne or skin inflammation, irritation, or who have some type of autoimmune condition typically don't tolerate cow's milk. We see it primarily in celiac disease, type 1 diabetes, Crohn's disease, which is an inflammatory bowel disease, multiple sclerosis, which impacts the brain and central nervous system, and lupus. With cow's milk, if you have a gluten intolerance, we typically see about 50% of the population does not also tolerate milk. But there are a number of individuals who do tolerate milk, and some tolerate yogurt or cheese, yet not cow's milk. Like me, for instance, I actually have test results that would indicate that I don't tolerate cow's milk, but I can tolerate yogurt and aged cheddar cheese. So there are modifications that can be made based on the appropriate testing, but we have to understand the importance of looking at these factors and screening for them because of the correlation with these relatively significant autoimmune conditions. Beyond gluten in milk, we have to look at food categories like nightshades, which include tomatoes, peppers, potatoes, eggplant, and lectins, which are found in essentially all legumes and grains. With nightshades and lectins, we see a strong correlation with rheumatoid arthritis and joint inflammation. So for many individuals who experience joint pain and they're not getting better, for instance, with chiropractic care or rehabilitative care, we may then consider making dietary modification or testing very specifically to determine if there's some type of reactivity from an immune system standpoint to the nightshades or the lectins found in these foods we previously described. Beyond that, we also see reactivity to food aquaporins. And you've probably never heard of food aquaporins, but these include spinach, soy, tomato, and corn. And in our body, specifically within our central nervous system, we have aquaporin channels that can be impacted, in which after we ingest some of these foods, like the spinach, for example, we can actually trigger an autoimmune response. This is specifically seen in neuromyelitis opticans, in which we see a breakdown of the central nervous system response secondary to the food reaction. So we don't always see that. However, I think it's very important to know that this mechanism is involved beyond just gluten, milk, and some of the common food intolerances we see. So I'll always argue, according to the literature, that gluten is something that we have to be very careful with. Yet I'll also argue that not everyone needs to be on a gluten-free diet. And I'll typically be the first to say that not all tests are created equally. And we're going to talk about that next, because if you're to essentially look over the counter and pick up a food test available to you at the store or at the market in general, I'm not typically thrilled with the detail of findings we look at. However, there are valuable pieces of information we can gather from that, and we'll talk about that as well. Before we dive into the testing, though, I do want to bring up elimination provocation diets. Commonly, we can refer to something like the Whole30, in which we remove inflammatory foods for a period of 4 weeks and then slowly reintroduce foods to determine reactivity. With that, the goal is to determine if we experience bloating, fatigue, irregular bowel movements, headaches, or symptoms when we reintroduce a specific food category like gluten, for instance. The issue I have with elimination provocation diets is that they're very hard to maintain, I find that most individuals can't maintain that strategy for 4 weeks unless they have the appropriate motivation to do so. Also, in many cases, we can see asymptomatic responses to these food proteins in individuals who are susceptible for autoimmune conditions down the line. So for example, if someone has a gluten reaction and it's impacting what's called their cerebellum, which is the little brain associated with balance, we can actually see later in life what's called gluten ataxia, in which that individual can't walk in a straight line because their balance center is completely fried due to that cross reactivity, or that molecular mimicry response rather, we see with gluten intake. And we typically don't feel that until it's actually too late. Therefore, I think it's really important to consider testing when there's a family history of autoimmunity, neurological dysfunction, or gluten intolerance, or other food intolerance in general, just to make sure we know these patterns and trends, even in those situations in which we don't experience symptoms. So I want to highlight that because that's usually the concern I have. Individuals who may feel great on a dietary strategy rich in gluten or cow's milk or a variety of foods may actually be creating dysfunction down the line. And one of my goals is to commonly screen for that to make sure that we're not contributing to some type of neurodegenerative disease or an autoimmune condition that could be really impactful on the quality of life, 10, 20, 30 years down the road, whatever it may be in that situation. Therefore, I actually prefer to look at testing. However, I'm very specific with testing. So with food sensitivity testing, we look at what's called an IgG, IgA response, as opposed to the IgE response associated with the food allergy. So an IgG, IgA combined response gives us the reactivity within the immune system that we're looking for with regards to the test, but it does not tell us whether or not you have an allergy to the food. So we have to differentiate the testing types and know that there's a difference between the food sensitivity test and the food allergy test. And the quality of test typically references what they look at and the testing procedures in general. So for instance, if we use the gluten example, this Cyrix laboratory panel actually gives us multiple pieces of information with regards to wheat and gluten, whereas a celiac panel may just look at alpha gliadin. So if you just look at one component of this protein, we don't get all the information, and we often get false negatives, which then allow us to believe we can tolerate gluten, for instance. However, if we break down gluten as a protein, we see what are called peptides, and peptides are small clumps of amino acids that typically make up the larger protein. And with gluten, we have about 60 different peptides. And when you look at a celiac test, you typically only test 1 to 2. So we're missing a lot of data and a lot of detail with regards to that. In fact, this test example here is the best, most comprehensive test available, and it's still missing information. I think we're going to see this evolve over time, but this is the most comprehensive test we have. Therefore, I'd much rather see this as opposed to a 180, 240 food panel with just wheat and alpha gliadin. I just don't have confidence that we're not looking in the amount of detail that I'd like to see with those more broad spectrum tests. And this test is actually very interesting because we can look at the different peptides and correlate them with different potential conditions. So for instance, if we look at gluteomorphin, here we can correlate that with ADHD or autism, given its impact on the brain, specifically with antibodies produced to the gluteomorphin. Beyond that, we can actually differentiate between transglutaminase 2, 3, and 6 and correlate transglutaminase 2 with gut dysfunction, which then drives that leaky gut presentation. We can also correlate transglutaminase 3 with skin dysfunction, in which we see dermatitis or eczema. And with transglutaminase 6, we know that gluten then triggers a response in the brain. And if any of you have read Dr. Perlmutter's book, Grain Brain, there's some really interesting information there regarding gluten and its impact on Alzheimer's dementia. And if we look at our reactivity, our immune system can impact other systems, and therefore we can see the concern in these other tissues. So this test really helps us differentiate that so we have a good idea as to what may be contributing. Beyond that, we often have people introduce a gluten-free diet and say, I did not feel any better. And with a gluten-free diet, we typically consume gluten-free alternatives. And first and foremost, a gluten-free cookie is still a cookie. So we have to be cautious with regards to sugar and additional ingredients. But in many cases, we see this process called molecular mimicry, in which, or rather cross-reactivity in this case, in which these other food proteins actually look like gluten to our immune system, and our immune system in turn attacks these food proteins. With the cross-reactivity, we see concern with regards to the inflammation secondary to these symptoms. So I think it's important for us to understand that we have to look at these alternative foods that are often overconsumed on a gluten-free diet in order to better understand if you're reacting to these replacements. So just to recap on that, to make it a little bit simpler, if you're consuming buckwheat, sorghum, quinoa, tapioca in place of gluten on a gluten-free diet and you're still not getting better, it could be because your immune system's actually reacting to these gluten-free alternatives. So in some cases, the gluten-free alternatives are just as much of an issue as the actual gluten if you are showing a non-celiac gluten intolerance or you test positive on the previous Cyrex panel that we just reviewed. Beyond the cross-reactivity panel, we have to consider in more detail the other layers with regards to reactivity. So if we look at the laundry list of foods here, we can actually test for a variety of potential food sensitivities that can trigger inflammation and then drive that immune dysregulation that we previously discussed. For instance, if we look at this list, you'll notice a lot of these foods are found within a healthy, well-balanced diet. And that's the issue with food intolerances or food sensitivities. Someone can actually react to very healthy foods. And I would argue that gluten, wheat in the right context may be healthy or maybe a good part of a well-balanced diet. But in this situation, if we need to gather more information beyond the gluten and dairy and some of these more common reactivities or intolerances, I like to look at a really comprehensive panel that includes things like beta-glucan, carrageenan, xanthan gum, and a variety of other foods like the legumes that are rich in lectins and the nightshades that we talked about with regards to the rheumatoid arthritis or other autoimmune presentations. So we have a lot of opportunity to look at tests. However, I'm very specific, like I said before, with the tests that I'll utilize. Given that one of the labs I partner with tests everything twice, we know we're going to get valid responses. Whereas with some tests, we're concerned if you tested it twice, you'd have different results. And if there's a variance within the lab I use, we know that they're not going to report that, or they're going to show that there's a variance in an issue and then retest again to make sure that we get valid findings. So there's definitely a difference between quality. We use the ELISA methodology and it goes into more detail from a laboratory standpoint as it relates to these tests. But I think it's important to know that it's best to work with someone as opposed to try to do this on your own, because you may show a pattern of leaky gut. You may show a pattern of lectin reactivity or nightshade reactivity and not know actually how to navigate that and not know what that means for your health trajectory. If you're overwhelmed, that's okay. There's a lot of information with regards to food sensitivities and intolerances. And today we have an opportunity to ask questions. We have a Q&A feature, and I'd love to answer or address any questions or concerns regarding the information I presented or regarding food sensitivities versus allergies. Just to recap a few things, though, I want to make sure that we know that the removal of gluten is not for everyone, but it's important to test. In addition, we have to look at other foods and these cross-reactivities to determine if someone's having a reaction to these things. And if there is a reaction, we want to make sure that we establish strategies to modify the diet and lifestyle, and then also repair the gut lining, because usually with food intolerance, we see leaky gut. And leaky gut, once again, is the doorway to inflammation. So we have a great opportunity to address questions. I do want to let you know that we appreciate you being here, and I'm going to take a few moments just to look at these questions coming in. So one of our questions is, could a child's eczema be treated with dietary adjustment? And the answer is typically yes. It doesn't mean that the dietary adjustment's the only way to treat that. However, we can see a lot of benefit, for instance, if someone has a gluten reactivity or a dairy reactivity, and that's driving the eczema. We also know that we need to establish strategies as it relates to supporting the gut microbiome and make sure that we don't have an imbalance of the good beneficial bacteria compared to the bad bacteria, because that can also contribute to eczema. Another question here is, have you found correlation between food sensitivities and depression and anxiety? And have I worked with such individuals who experience that? Absolutely. So if we look at the brain, for instance, depression is not necessarily just an imbalance of neurotransmitters. Depression is typically a result of inflammation or lack of circulation or lack of nutrients. And if we have food intolerance or food sensitivity and we're not able to absorb these nutrients secondary to inflammation in the gut, we can see this vicious cycle that impacts our frontal lobe function. Because depression occurs in the frontal lobe, we have to understand what supports that, and food intolerances can play a role in that. However, once again, it's more nuanced, and I think it's important to know that we have to go far beyond just food intolerances when working with something like depression. Really good question, though. Another question here is, what are your thoughts on consuming cow's milk in just a small amount? Yeah, that's a really interesting thought. I think for those who tolerate cow's milk, it can be consumed potentially in a small amount. However, if you have immune reactivity identified in the test result, then I'm very, very cautious to introduce cow's milk at all, because it does not take much to activate the immune system, and the inflammation from the introduction can last for up to 3 months. And when we're considering potential molecular mimicry with brain function or pancreatic function, I'm really hesitant to introduce it at all if we have evidence of reactivity. Another question here is regarding FODMAPs, which we see in common foods that drive gut bloating, and we correlate with a small intestinal bacterial overgrowth. We do help with treating FODMAPs, or rather treating the bacterial imbalance that then feeds off of certain foods rich in carbohydrates or sugar. However, that often looks a little bit different. We may introduce other testing to help us understand if there's a bacterial imbalance. Another really good question here regarding acid reflux. This states, or rather asks, can acid reflux be associated with stress rather than the foods you eat? And absolutely, stress impacts our systems significantly. If we look at the gut, for instance, stress impacts the microbiome. It impacts the beneficial balance of bacteria. It also thins the gut lining if we look at cortisol. So I think stress is absolutely a piece of the puzzle, and we can actually look at your stress response via a full day rhythm of stress hormone to determine if you have the right rhythm or the right balance. And in that case, that drives into the other treatment strategies. And another question here asks if we have any associates in the Woodridge, Downers Grove area. And we do have multiple locations throughout Chicago in the suburb region. Therefore, my recommendation will be to visit AlignModernHealth.com to check out those locations, because typically we have very convenient locations, and I have great providers on my team that I partner with that can provide functional medicine beyond our Wicker Park location or our city locations. I have another question here regarding the IgG tests and how a lot of physicians dismiss its accuracy. What is the IgG test accuracy level? This is a really good question, and it's really dependent on the individual. So if we have, for instance, immunosuppressive drugs within the past 60 days, we know that the IgG accuracy is going to be very low, because we actually reduce the immune system response, which in turn changes the test accuracy. We also know with IgG testing, we can see issues with leaky gut. So if we see that pattern of reactivity to everything you're eating, it reduces the accuracy of the test, and we have to correlate that with a positive leaky gut and then treat the leaky gut to then allow the body to recover. So it's really difficult to answer that with a very specific number because it is so individualized, but very good question, because I don't test everyone with regards to food intolerance testing. I think it's really, really important. Okay. And then looking up here, I have a few more questions within the chat box, so let me take a look at those as well. Okay. Forgive me as I take a look through some of these. Oh, interesting question regarding nightshades. If they are cooked, does that change or lessen the effect of them on how your body reacts or receives them? So in some cases, if we look at certain foods like nightshades and lectins, the way they're prepared and cooked does change how our body reacts to them. However, if we have a true identified protein reactivity, we have to be really cautious with how we introduce those. And to really navigate that, we typically work with a registered dietitian or clinical nutritionist on our team to help mitigate those concerns. Okay. These are really great questions. I appreciate all of the questions, everyone. So with regards to the timing of food sensitivity, we have a question here asking if the reaction can occur within a few hours after eating something. And yes, we can see that reaction occur shortly after a meal. However, we can also see that delayed response up to 3 days later. Therefore, it's really important to differentiate if that's an anaphylactic type reaction or an allergy reaction, or if it's something specifically associated with some type of intolerance or sensitivity. So we can see that, but we have to look at symptoms and then determine if it's more of an allergy or a sensitivity. Another really good question. We see some foods labeled in the market as natural. What does it mean, and do we need to worry about it? So with natural flavors or natural ingredients, I'm really hesitant when I see that on a food. Typically, we shouldn't have to market healthy foods. And when we see natural flavors, for instance, that can mean a lot of things. So for instance, with MSG, monosodium glutamate, we can see a reaction in the brain. And there's a whole process called neuroexcitotoxicity that occurs when we consume MSG and the individual who may be susceptible. And with natural flavors, that may be a hidden source of MSG. We can see that with other foods hidden within other ingredients. So that's a really good question. I think it's important to eat real food and try to avoid ingredients you can't pronounce, or be really cautious with natural flavors unless you can get the information from the company. Here's another really good question regarding autism and the correlation between digestive dysfunction. The question is with regards to how we work and partner with individuals with autism, and I would be happy to address that very specifically, or a team member would via consultation. So I think it's always important to reach out if it's very personal to have that consultation, just so we can provide a very direct answer, because I think that's a very important thing to navigate with the provider as you try to build that relationship. And then there's another question regarding, is food sensitivity testing covered by insurance, such as Blue Cross Blue Shield or other forms of insurance? And typically the answer is no. Insurance will cover food allergy testing depending on your insurance coverage plan. However, no insurance at this time covers food intolerance testing or food sensitivity testing. Therefore, we typically partner with the best labs beyond insurance to gather that information. Another question, are tests covered by insurance? So typically we do test whatever we can and run that through insurance with regards to blood chemistry, but there are some tests that we have to go outside of that to get essentially run. So that's definitely a good question to ask in more detail. We're always transparent on what that looks like. So I'd recommend a consultation as well, just to discuss that so you know exactly what that looks like. Here's another good question regarding leaky gut. Can we repair leaky gut? And is that true? The good news, yes, we can repair leaky gut. We can actually test for leaky gut too, and then retest to determine if we've recovered. With regards to treatment, there's dietary modification. We have to remove the trigger foods. We have to then introduce factors that heal and seal the gut lining. So there's definitely an opportunity to do that. Another really good question here. If I'm following a new diet and restricting certain things like gluten and dairy, what are the chances that I may overdo it on chickpeas, teff, etc.? I also think that's a really interesting idea. He also mentioned Diet Coke from time to time. With the overconsumption, I do think that's a concern at times, because we do sometimes lack diversity in our diet when we remove too many foods. So the goal is to get as much diversity in the foods tolerated as possible. The more diversity in our diet, the more we feed our microbiome, and the better we establish a balanced nutrient uptake. So it's okay to eat alternatives, but we want to make sure those alternatives are diverse, so we're not taking in just the same alternative. Also, Diet Coke, that's a fully different conversation. I'm not a fan of Diet Coke given the aspartame and that's impact on the brain cells. We talked about the neuroexcitotoxicity earlier with MSG. We also see that with certain artificial sweeteners, and that creates a brain disruption. Another question here is the food sensitivity you offer a blood test? If so, how much blood is drawn? And typically, I like to look at blood testing for food intolerance or food sensitivity. We typically take a few vials of blood and send them off to a specialty lab so we can get a full IgG, IgA combination of testing. And then another really good question regarding food allergies, intolerances, and sensitivities as it relates to thyroid function. Can food intolerances influence your thyroid function? Absolutely. So specifically when we look at Hashimoto's, which is an autoimmune form of thyroid dysfunction, we can see gluten create that type of reaction, given that there's the molecular mimicry between the gluten protein and our thyroid tissue. Another question here is, could certain food allergies or sensitivities contribute to being overweight or having a hard time to lose weight? It can, given inflammation and other pathways. So if the body's inflamed, it's very hard then to establish normal physiology and normal function. So we can absolutely see that correlation between weight loss resistance and the inflammation associated with that. All right. Well, I appreciate all of these questions. I wish I could answer them all. Any unanswered questions may schedule a consult. I completed one of the excuse me, I'm reading off questions as I finalize this. But once again, guys, I thank you so much for this time, for all of these wonderful questions. I want to get to all these questions. I'll try to reach out in the future to answer additional questions. But please understand that if you have further questions, you can schedule a free 15-minute consultation with one of the functional medicine providers, including myself, or we'd be happy to try to point you in the right direction with regards to the appropriate services.